Well, plasma state process, we've been talking about it. First of all, you can eliminate the old invasive hemorrhoidectomy. That was part one, just trying to get this to ConMed and to you, the consumers, because only your demands actually make the social change needed in medicine, unless, they've spent millions of dollars on some project they're going to market. But the reality is that your choices change how we practice medicine. So you have plasma state process that can make hemorrhoids vanish, and without complications, pain, without cutting, without suturing. That's a pretty good deal. Now the other thing is that we can take out breast mass, breast implants, and reconstruct the breast at the time without an implant. That's right. Without putting another implant in, and not deform the breast. In all the studies I've done, there was no deformity. So I don't think I have magical hands. I don't think that I have a halo over my head. I think that the technology is what's at issue. Third part now is the cervix. The cervix is the end of the uterus, and women get vaginal infections, and they get a disease called vaginal adenosis and vaginal inflammation that happens to the cervix, and the cervix grows and gets big, really big. So normally you're supposed to have a cervix like the size of a quarter, and when I talk really big, I'm talking huge. And that can look like a prolapsed uterus, but it's not. It's just this massive, huge cervix in the body. And it can put pain on the bladder, pain on the rectum, it can cause constipation, all sorts of things. That's a DVD that I'll be doing. But here's the cool thing. I created a plasma state process to reconstruct the cervix so it still works, still functions, it's still there, but it's not huge anymore. Also, by doing this, the infections that are caused, which lie in the cervical cysts, there's the Bothnian cysts in the cervix, and in some cases, I did one case where I counted 200 cysts, and we cultured the cysts, and it was the cysts that were causing the recurrent discharge and infection in this patient. By removing all 200 cysts and leaving a normal amount of glands in the area and taking out all these inflamed, infected glands, we reduced the size of the cervix and we stopped the chronic infection in the patient. This can be done. It's cervical reconstruction by plasma state process. And ConMed, it can be taught, and a whole new range of operations for a disease that doctors don't even talk about, that they don't even understand, and they just do hysterectomies for large cervixes. You don't need a hysterectomy for a large cervix. You can do the procedure in 15 minutes. The patient goes home the same day. They heal in 4 to 6 weeks, and they have a normal cervix. Now that's minimally invasive. We had no complications in over 1,000 cases. Over 1,000 cases of these enlarged, prolapsing, and often infected Bothnian cysts in the area, and this was common. Common complication that women have when they get chronic infections or they have a problem with birth where their cervix was torn. But mostly it's a combination of things: chronic infection, a surgical tear. We've seen cervixes abnormal that have happened from a D&C where the surgeon tore the cervix and it didn't heal right. But all of these can be reconstructed safely, outpatient, and it's pretty easy. Now, ConMed, why didn't you change this 10 years ago? What are you waiting for? Don't you think that saving women from hysterectomies might be a good idea? And preventing them from having recurrent infections? Pretty good idea. Leaving another note for ConMed and for you, the patients out there who don't get all this information and only get told certain stories. So stay tuned for more information from the Ethical Times. Thank you.